Okay, sorry guys, I'm back. I got a phone call and I hit end and then it made it look like the video restarted, and then I hit end and then it made it look like it was the same video. So I'm sorry. I am going to restart what I'm talking about because I really want to publish this for the people that don't get to watch it when I'm done. So I'm sorry. I'm back. I had some technical difficulties. I got a phone call and it all jacked up. So anyways, I want to talk about nursing burnout. I'm going to kind of start over for any people who were already in the last live chat like a few seconds ago. So I just got off working 3 shifts in a row, which is a lot. And for those of you who have never worked 3 shifts in a row, you're probably like, oh, it's only 3 shifts. Like most jobs do that. But when you're working shift work, especially 12-hour shifts, especially as a nurse, it is very physically and emotionally exhausting. And I really want to talk about tips for the, not tips, sorry, I was reading comments. I just hit the chat off because it distracts me, but I will answer your guys' questions when I'm done talking about this. I want to talk about nursing burnout because it's a very real thing that happens to nurses, especially bedside nurses. And some of the causes of nursing burnout, at least from like my own personal standpoint in viewing and knowledge, is that nursing is a very, very emotional, physical, mental job. Emotionally, because you are dealing with people who are sick, or you're dealing with people who have bad outcomes, or people who are in the hospital because of decisions that they didn't make for themselves. And being an ICU nurse, especially, we deal with a lot of people who are very, very sick, who are probably not going to make it, or who have slim chances of making it. And we're working with their family members and being that emotional support, and we're advocating for our patients and what they need. And that takes a lot out of you, even if you don't realize it. It's physically exhausting because you're turning patients, you're getting patients out of bed, you're helping patients to the commode, you're boosting them up, you're helping them move so that way they can be active, because we know how important early mobility is for patients, and moving around in general is so important. Mentally exhausting because sometimes you have patients who they just don't get it. They're very disrespectful. They treat you like you're their maid. They treat you like you're below them, that you're just there to serve them, when in reality you're there for their health. And yes, we care about their feelings. Yes, we care about, that they got dinner and all these things. But in the end, like, you're there for their health, and you're there to save their life, especially in the ICU. And little side note, I'm going to go off on a tangent, personal side note. In the ICU, patients are very, very sick. And most of the time, they're not eating because they're intubated. They'll get feeding tubes and we'll feed them, so don't worry about that. But things, and we're saving people's lives. And then sometimes we get these patients who maybe are going to be downgraded to telemetry or med surg, who are, doing better, which is great, who are very, very demanding of you and your time. And little things like, oh, their dinner tray took them too long to get there, and they're so mad, and they're yelling at you and screaming at you, and you just want to say, do you understand that right next door that person is literally 2 seconds from dying? Like, I'm sorry, your dinner's late. Anyways, side note. But that can get very, very mentally, physically, emotionally exhausting when you've got these, emotional situations, physical situations, and when people are just very demanding of you. And also, a side component is, maybe your management isn't super supportive, or you're short-staffed, or things like that. That can all tie into nurse burnout. So I can see how nurses easily get burnt out, especially at the bedside, because, when you just don't feel like you're appreciated, or you don't feel like, or you saw something really tough, it can be hard. So with that being said, what can we do about this? So an important thing is, 1, to have good coping strategies. So if you see something that's terrible, if your patient codes, or just a really hard situation, make sure you have an outlet to talk about that with another nursing friend, or your manager, or a friend, or whatever, or have a healthy outlet like working out, things like that. You really have to find the balance between leaving your work at work and bringing it home. And I'll admit, my first 6 months of nursing, I did not sleep that well, because every day I went home and constantly thinking about the day's events. Did I forget to chart this? Did I do this? Did I do that? And it just became, one, I was exhausted because I was a new nurse, but you just play all those events in your head. So you really have to learn how to shut that off. Work is work, and when you go home, you go home. And one thing I've realized as a nurse, especially being in the ICU, is I know my nursing abilities, and I know that I am going to do the best that I can and treat my patients the best that I can and do everything I can for them. And at the end of the day, that has to be good enough. Yes, we always need to learn and grow. Yes, we need to be striving to be our best. But if you are providing the best possible care that you can, then that is what it is. All the outside factors, the doctor that didn't respond to the phone call, or the doctor that didn't answer this, or the tech that couldn't come in to help you. And I'm not trying to place blame on other people, but if you do the best that you can, that just is what it is. Another thing I tell my nursing students that get paired with me a lot is, we as nurses tend to emotionally invest ourselves in our patients, which is healthy and good to a certain extent, but you don't want to get too emotionally involved. And sometimes it's hard. Sometimes it just happens. But at the end of the day, and this is going to sound super, super mean, and I hope people don't take offense to this, but it's true. At the end of the day, none of the patients that you take care of matter. What matters is your health and your life and your family's lives and the people that you care about most in your life. And yes, it's important that we care for our patients, and we know that they have loved ones, and we need to treat them like a loved one, so to speak. But at the end of the day, they don't matter, and I know that sounds terrible, but it's true. What matters is your health. You have to take care of yourself first, because if you don't take care of yourself, you can't take care of others. And that is 100% true. So often, and I'm guilty of this too, we skip our lunch breaks, we hold our bladders because we have to pee, we don't drink water because we don't want to go to the bathroom because we're so busy trying to meet other people's needs. And which is a great thing, but it also leads to people getting really tired and burnt out. And you need those breaks, you need that time to kind of step away and, just decompress, even if it's just for your 30-minute lunch break. And I know I'm guilty of, you have so many things to do that you can't even enjoy your break because you're just so busy that you just sit there and think about all the things you have to do when you go back. But it's really important to just be able to sit down, at least eat something, so that way you are fresh and on your best game, especially if you're working with really sick people where you need to be mentally and physically and emotionally strong for your patients. So that is my little spiel on nursing burnout. Make sure you have a healthy life balance. Make sure you're talking with other people. And if you really are truly feeling burnt out and there's nothing is working, then maybe consider switching specialties or spicing it up or changing, not doing bedside, maybe going more of a businessy or management side of things. There's so many jobs that you can do as a nurse, which is a wonderful thing, because if one thing is tiring you out and burning you out, then you can go back and do something else. So that's my spiel. I am going to open up the comments now and answer a few questions, and I'm going to go because I have not eaten dinner yet, and I'm hungry, and I want to shower, and I want to go to bed because I'm so tired after working 3 hours. And I realize how much I'm doing this with my hand, and I know it's probably annoying, so I'm sorry. But I'm not, because I just talk with my hands. All right, I'm going to turn the comments back on. Oh my gosh, what is going on here? So Andrew's my brother, so if you guys are seeing any annoying comments by him, he just likes to come on and purposely say annoying things because he just, likes to do that because he's 16 and he's a teenager and he likes to try and be cool. So anyways, that is why he likes to tease me. But anyways, I'm going to open up for a few questions. So if anyone has questions, and if you're on right now, you should give this video a big thumbs up. That's always fun. Sorry, going down. So Imani, I think that's your name, asked if I take my scrubs off before I come in my house. I typically do. I know that's kind of stereotypical, or I'm lying because I didn't tonight. I didn't tonight because usually I take my scrubs off right in my laundry room, which is right behind me, and my garage comes into my laundry room, and then I go straight to shower, or I just eat dinner in my underwear, which I know is kind of TMI. But I didn't want to come on here in my underwear. Surprise, surprise. I know that's totally what I do all the time. Just kidding. And I didn't want to like change my pajamas because I feel so like just like I need a shower. I just feel gross. Like I smell. I know that's TMI, but I just feel like sweaty, if that makes sense. And I just need a shower. If you know that feeling, you know what I'm talking about. What GPA did I have to get into nursing school? So that it depends on which program you're going into. I think for mine you had to have a 3.75, a 3.8 was kind of the recommended average. It really depends. I had a 4.0 going to nursing school, and I'm not saying that to brag, just answering your question. Do I think I will precept soon? Yes and no. So I already take on nursing students. That sounds bad. But I already get paired with nursing students during my shifts, so I guess I meet the criteria for that. I didn't get nursing students my first like 6 or 7 months of working as a nurse because they just don't want to overwhelm you, especially being in the ICU. But I need to take a class to precept in order to be a preceptor and get paid the extra hourly amount for being a preceptor, and I want to, but there's other classes I want to take first. I want to be more knowledgeable. How's life with my husband finally being home? It is great. It is nice to have him home. Do I ever talk back to patients who are rude? How do you respond to make them not become violent? So this is a good question. So I have come to a point in my nursing career where I'm a very patient person, and I understand if someone's confused and being just rude. I want to say disrespectful, because if someone's truly, honestly confused, that's a different story. But if someone is being rude just to be rude and continuously is rude, or for example, I had a completely alert and oriented patient who just thought it was okay to scream their head off outside the room, screaming my name, yelling for things when they were perfectly capable of, 1, using their call light, and 2, being a little bit more patient, because I can't be in there every 2 minutes. So anyways, after, once this patient just kept yelling, so I finally, when I went in the room, I said their name. I said, look, you cannot be yelling. We have many sick patients here, and your yelling is being very disrespectful and very rude to all these other patients who are trying to rest and trying to heal. And so I've learned as a nurse how to better, I guess, put my foot down, if that makes sense, or I just don't really tolerate being disrespected as much by patients. And I'm not saying I come out and am rude to them or anything. There's a professional way to talk to people who are being inappropriate or rude or disrespectful to you. But I also think it's important to not just take everything. I know it sounds bad, but like, you're not there to like be, for lack of better words, bitched at or yelled at or downright disrespected. And every situation's different, and I'm not saying I'm like that for every patient, but who does that, it really depends on the situation. And I'm a very patient person, and I'm very I don't get overwhelmed, and I'm very calming, but there's a time and a purpose, and I don't think that nurses should have to take a beating by someone who can be in control of their actions, if that makes sense. I hope I'm coming off the way that I'm trying to. I don't want to sound like I'm just this nasty, mean nurse, because I'm not. Sorry, going back up to read some questions. I'm so tired. I just need to get off of here and eat dinner and shower. Do nurses really earn good money, or is it just people say? I think it really depends on where you're at. I think that nurses make decent money for having a 4-year degree. I also think that we do a lot of things to earn that money, and I also think some days we don't get paid enough. So that is my spiel on that. Everyone's different. I think it depends on how you're raised and what like you think a good income is for the job that you have. Would I say the majority of the patients I work with are appreciative of your care? Yes and no. I feel like I see both in the ICU because people are scared in the ICU. Their family members are scared. People are dying, like they're sick. They're very sick, and it's very scary seeing all this stuff. So I feel like family members are usually pretty appreciative of everything that you're doing. You form kind of this good relationship with the family members and the patients. But I would say there's also a lot of them that are just downright not appreciative or manipulative, or I don't know what their deals are. But you take it with a grain of salt because it's the people that do appreciate that really makes it worth it. So Shalisha, you got an interview? That's awesome. Yes, I've considered becoming a CRNA. Sorry if you hear the squeaking. My dog's squeaking his toy. Why do you dislike psych? It's going to sound bad. I don't want to say I dislike psych. It is not my strong suit, and it's not something that really interests me. I can appreciate the nurses that do psych. We see a lot of psych no matter what job you do in nursing. Even if it's not psych, you still will see it. So I appreciate the nurses who are really good at psych because it's a very hard thing for me to understand and comprehend and sympathize with. Not sympathize, that's the wrong word. But it's not something that I've really dealt with on a personal level in my life. So most of the things I deal with, I have never dealt with in my personal life either. But it's just not my strong suit, and everyone has things that are not their strong suit. So, but bless the nurses I do psych because you guys are rock stars, seriously. Any tips for the ICU? I actually have a video on this, so go check that out. Going through. Sorry, so many things. What's for dinner? I don't know. I'm thinking about just having yogurt and granola. I know it sounds so bad, but for some reason it sounds good. I also have a leftover piece of chicken parm in my fridge, but I don't have like anything to go with it, so I don't want to just eat chicken parm in marinara. Or maybe I will. Maybe I just will eat chicken parm marinara, because now that kind of sounds good. I don't know. How do I take care of my dogs? As a nurse working long hours, I have a dog sitter and my husband's home. How long did it take for me to get my BSN? It took me 3 years. I worked through my program really quickly, and I also had a lot of credits going in. 108 people in here. You guys should all give a thumbs up. If you haven't given this video a thumbs up already, give it a thumbs up. I'm going to answer like 5 more questions, and then I'm off. Because look at me, guys. Can you tell that I'm literally so exhausted? I know it looks like I have big bags in my eyes. I think it's kind of just the shadows, but I went down if I actually do. So, therapeutic communication, yes, very important. That's like the first thing they taught us in nursing school. Yay, all the thumbs up. Everyone's thumbsing up. That's a word. What do I think is a good GPA before you get into nursing school? I think it really depends on your program, but I would say if you have a 3.5 or higher, then that's really good. What advice do I have for coping with the stress of nursing school? Really having a good outlet, good friends, healthy ways to relieve stress, exercise, cooking dinner with your friends. I was going to say drinking wine, but that's not really a healthy way to cope. But it's always nice to have a glass of wine if you're a drinker. I just sound like an alcoholic, clearly. Every time I post these videos, do these live chats in my kitchen, everyone's always like, oh my God, she's an alcoholic. Guys, I have been collecting these bottles for a long time, okay? And it's not just like me who's drank them. It's usually like when I have family over or parties or things like that, I save them all. So I'm not an alcoholic. I have done my little scale thing at work when you have to when you get a new admission, you screen them for alcohol abuse. And I'm like a 3 out of 15 or whatever. I'm a very low risk for alcohol abuse, so don't worry. Does anyone else do those scales on themselves? Because I do this all the time. Have I had patients pass away? Yes. Several patients have passed away on my shifts. Am I going to go back to school and work at the same time? I have no idea. I don't know. As an ICU nurse, do I see a fair share of suicide attempts? How do I handle emotionally different than normal cases? I have had several overdose cases, intentional and not intentional, but I don't know. I guess you handle them like any other patient, and pretty much by the time that if they're intubated, by the time they get extubated, they get transferred to the other floor, and psych comes and sees them, so you're not really involved too much. But it's really just working with the families and then keeping the patients safe. Hey, that's loud. Don't bark so loud. They're all excited. Am I interested in OR nursing? Not really. Does the ICU have PCAs? Are you talking about like PCA pumps or like techs? And yes, we have both. I know, I look tired. Andrew, I did not kill someone my first nursing shift. He's just saying that because he's my brother and likes to be annoying. All right. Do you do a lot of CNA work as an ICU nurse? Yes. I wouldn't really classify it as CNA work because I feel like that puts kind of this separation between CNAs and nurses, which obviously there is because you have different licenses. But if you're talking about CNA work like vitals, changing patients and blood sugars, things like that, yes, because as a 24-bed ICU, we have one tech. And so we are pretty much do all the total care, and the tech helps us out. But there's a lot of if we have 24 patients and there's only one CNA, they physically cannot possibly help out every single nurse with every single turn and boost and things, especially because we have a lot of people that are intubated and they poop all over the place and they need turned every 2 hours. And so really you rely on your neighbors, your buddies who are there. So anyways, I am gonna go. I'm super tired, I'm hungry, and no, I have not fallen asleep at work, but I'm about to fall asleep right now. And yes, I talk to doctors about ABDs a lot. That's what we spend a lot of time doing. And I'm gonna go. That's my 2 cents on nursing burnout and all your questions. So thank you guys for watching. Again, actually I don't know if I said this in this video. I'm not gonna have a video up tomorrow. I've been spending time with my husband and have not made time to record videos, but my plan is to record on Sunday to get videos up for the next couple of Saturdays. So thanks for sticking in. If you're still on, give this video a thumbs up, and I'll see you guys in the next video. Bye!